Hi, Mama. I'm Jada Glover. I'm so excited that you're here with me. So, we are going to be diving into the Lactation Mamas online breastfeeding course. And congratulations. I'm so excited that you're here and that you're having a baby and that you're preparing for this time. So, we're just going to go through a few of the um, few intro things here and help you get started in the course. Hi, Mama. Welcome to the Lactation Mamas online breastfeeding course. I'm so excited that you're here with me. We're going to go through a few just kind of housekeeping items for getting started in the course, and then we will dive right into some course content in the next class. So, just a couple things. So, I'm so excited for you. Congratulations. You're investing in you and your baby's health. So, that's just such an awesome thing. And breastfeeding is such a magical bonding experience, but it does take a lot of energy, commitment, dedication. But please remember, it's always worth it. So even when you're having a hard day, just remember that these times will pass and it will be so worth it in the end for you and your baby. And it gets easier too. So, also surround yourself with positive support and remember all the amazing benefits that you're providing for you and your baby. And you can do this. Remember to keep that a positive mindset because that will be key in, overcoming some of those more difficult days. So a little bit more about the course and what will follow from here. So all course materials can be accessed through the login on my website. So just head over to lactationmamas.com and then you'll see a My Account tab there at the top. You can log in with that, and your login information is sent to you directly whenever you purchase the course. So you should have that. If you don't, feel free to send me an email and I'll check into it for you. lactationmamas@gmail.com. And you'll be given access to 1 to 2 classes per week. And I do it this way so that you don't feel overwhelmed with too much material. So you probably have, several weeks before your baby's born. And even if you don't, that's okay too. You can still look at the content after your baby's born too. So either way, the material will be timeless in the sense that it won't be outdated. So you'll be able to look at it after your baby's born too, and if you have future babies as well. So that's the beauty of this, is that you get lifetime access to all course materials so that you can always look back if you need to. So if you feel that something's missing along the way in terms of, specific content, please let me know so that I can make it the most valuable experience for you. So if you feel like you need a little extra information on, whatever it may be, just let me know. You can send me an email or post it in the Facebook group too, and I'll be able to look into that and add the material and then obviously send it to you too. So if you have any material related questions, feel free to post them in the Facebook group along the way as well. I'll be monitoring that. And I'll also be hosting live videos in the group too, once per week. So hopefully those will happen either on Thursday evening or Saturday morning, just, as schedules allow. And I will be in there, and I'll also try to get some feedback and questions from you all so that I can answer those on a live video. And like I mentioned, share any feedback directly with me or in the Facebook group. So here are some more general notes. So my definition of exclusively breastfeeding. So this comes from course material that I use during the certification process to become a certified lactation counselor. And so the definition of exclusively breastfeeding is a baby is exclusively breastfed at the breast or through manual, electric, pump, or hand expression. So any of those means that you're exclusively breastfeeding your baby. Your baby is getting breast milk from you as the mom. The World Health Organization's hierarchy of feeding choices. So I think this is interesting because it shows us what we should be focused on, in terms of 1 through 5 for, if we need to supplement, what the better choice would be. So baby at mother's breast, so that's breastfeeding, your baby at the breast. Your own milk would be number 2. So, expressing your milk through, a pump or hand expression. Number 3, milk from a milk bank. So again, human milk from another mom that's been donated. Number 4, cow milk formula. And number 5, soy formula. So that's the order that the World Health Organization suggests mothers feed their babies. So here's some facts. Although 80% of pregnant women in the United States intend to breastfeed, only about 40% continue as long as they do, according to the American Academy of Pediatrics. So why do they stop? There's just a lack of information or support, especially during the first week. So we've seen studies that reveal that the mother may stop because she doesn't have the confidence that she needs, and that may be attributed to a lack of support during those first few days especially. And she may be experiencing problems with their baby latching, suckling at the breast, nipple pain, or concerns about milk quality or quantity. I like to include some quotes along the way. I feel like they're inspiring and helps you keep a positive mindset. So breastfeeding is a mother's gift to herself, her baby, and the earth. And breasts were made for breastfeeding. Breastfeeding is normal, achievable, and desirable. Breastfeeding is natural, but does require learning new skills and techniques, you and your baby. So this is something that I think is a misconception among a lot of mothers. And, it was for me too, before I had my son. So whenever moms are pregnant, they often think that breastfeeding is going to come natural. And that may be you too. And that's okay. It's okay to think that, because breastfeeding is a natural thing, right? Our bodies are made to produce breast milk for our babies, but it does require new skills and techniques. So just like think about, riding a bike. We can ride a bike, right? But we have to learn the new skills to be able to do so. And in practice over time, it'll make you better. So, just like riding a bike in that analogy, similar to breastfeeding in that sense. So have patience with yourself, have grace, on both you and your baby as you learn each other. And you're not just learning about breastfeeding, especially if you're a new mom. There's so many other things that you're probably learning about now that you're a mom and your baby is outside of the womb. It's a whole new world. So you do become a, kind of a different person, because you're adjusting to this new lifestyle. You're adjusting to sleep deprivation in the, those early weeks. And it's real, whether you're bottle feeding, breastfeeding. Sleep deprivation is, a real thing, because babies are awake and they only take small amounts of milk at a time during their first several weeks. So it's important to realize that they may, and they will, nurse during the night too. So if you have any questions, just make sure you pop them into the private Facebook group, and I'll be monitoring for them there. And I will see you in the next class. Thanks.